Hello.
Hello.
I'm Dr. Goodfellow, nice to meet you. Thanks for agreeing to speak to me today. Are you quite comfortable here while we go over some things?
Yep.
I'm just going to ask you some questions about your urological history. Do you mind to start with just tell me your name, your age and what you do for a living?
Yep, my name's David, I'm 24 and I sell mobile phones.
Okay. Now I believe you've been having some pain. Do you mind just starting with that and tell me a little bit about that?
Yeah, just recently I've begun to have really extreme pain in my kind of lower left side kidney area, and it'll extend down towards my groin as well, but all kind of along from back to front, and it just comes in really intense spouts, so maybe 20 minutes at a time, and when it comes it's just really excruciating, and I kind of need to, I don't know, just walk it off and breathe, and I can't really do anything else when it comes on. It's extremely painful.
Sounds pretty unpleasant. So how long has this been a problem for?
Just less than a week, but it's been getting worse progressively, yeah.
Okay. And it starts at the back, you said?
Yeah, at the back, lower left side,
okay.
And then, but the pain extends around to my groin as well.
Okay. And how severe is it, if you were to give it a number out of 10, 10 being the worst pain?
It's the worst I've ever had, so 8 or 9.
Okay,
Yeah.
so pretty bad.
Aye.
And does it build up, or does it come on suddenly, very, very severe?
It just comes on very quickly, and then takes, like I said, 10-20 minutes before it dies down.
Okay. And does it go away completely?
Yeah, it would more or less go away completely. You would notice it for a bit after 10 or 20 minutes, but then I wouldn't think about it until it came back.
Okay. And the pain itself, what does it feel like? Does it have a particular...
Just very, sharp pain in the area, but then overall it just makes me feel very uncomfortable and sick to my stomach. A few times I've thrown up during an episode.
Okay. And does anything seem to aggravate the pain and make it worse that you've noticed?
Not really. I mean, passing urine is much more uncomfortable.
Okay.
And then obviously when it happens, it hurts a lot.
Okay.
Nothing seems to make it much better.
Nothing makes it much better either. Okay. But you feel you need to get up and pace around and...
Yeah, that'll help when I kind of just walk around, take deep breaths, and.
Okay. Have you had a fever with it? High temperatures, anything?
No.
Okay. And you mentioned that passing urine's more difficult, more painful. Is it? Okay.
Yeah, and there has been some blood in my urine as well.
Okay. And those things
disconcerting.
Yeah. That's quite an alarming thing to have. Are those things just new as well with the pain that hadn't happened before? Okay. And have you lost control of your your bladder at all?
No.
Not being incontinent? Fine. And when you do pass urine, is it painful?
Yeah.
Okay. And do you have trouble stopping passing, or has that not been an issue?
I guess that might be a bit more difficult, but it's more just the pain of the whole.
Okay. And apart from the pain that you've described already, any other back pain or pain elsewhere?
No.
Okay. Any leg weakness? Numbness in the legs at all? Have you had any weight loss?
No.
Have you lost your appetite?
No.
Okay. Any masses or pain in the testicles?
No.
Okay. And any change in your sexual function?
No.
And have you had sexual contacts recently?
Just with my wife.
Okay. So nothing else?
No.
Okay. So this is pain that started the last couple of days. It's worse. It begins on the left side at the back, radiates down into the groin. It becomes very, very severe. You have to pace around. You felt nauseated. You vomited a couple of times. A little bit of blood in the urine, and passing urine is a bit more painful and uncomfortable. Okay. Have you ever had anything like this before?
No.
No. Okay. So any other medical history or problems in the past?
No.
Nothing at all?
Nothing major, no.
Okay. I'll just go over a few things.
Right.
Any urine infections in the past?
No.
Any kidney stones that you know about?
No.
Diabetes?
No.
High blood pressure?
No.
Any gout in the past?
No.
Okay. Any surgery in the past at all?
No.
Okay. Are you on any medications for anything?
No.
Okay. Any over-the-counter herbal remedies?
No.
Any recreational drugs at all?
No.
Nothing. Okay. Any allergies to drugs that you know about?
No.
Okay. In terms of family history, parents, siblings, anything like that, do they have anything significant?
Yeah, my father had kidney stones, and so naturally, my main concern is that this is probably what it is.
Yeah. Okay. Fine. Any other kidney trouble in the family that you know about?
No, just my father.
Okay. So nothing like polycystic kidney disease?
No.
Any bladder cancer or anything like that?
No.
Okay. Now, what do you do for a living?
Cell phones.
Cell phones. Okay. Have you been able to go to work the last few days?
I have. There was a couple days where I left early just because it was coming on more often than before, and so yeah, recently I've started taking time off.
Okay. Have you done any other jobs in the past that involve exposure to any chemicals or dyes, anything like that?
No.
And have you travelled anywhere recently?
No.
Okay. Are you a smoker?
No.
And do you drink any alcohol?
Moderately, a few units on weekends.
Okay. Anything else that you think you'd like to bring up or that we've not covered?
No.
Okay. Well, thanks for speaking to me today.
Thank you.
So in summary, this is a 24-year-old gentleman who is a mobile phone salesman. He presents with a few days of severe left-sided loin pain which radiates to his groin. Severity is 10 out of 10 at its worst. It builds up quickly and then wears off. During these episodes he has to walk around, he feels nauseated and he's vomited on occasion. There's also some associated dysuria and some hematuria as well. Family history is significant for renal stones in his father. There's no other medical history of note. So in summary, this could be consistent with some renal calculi. To investigate this, I would want to sample the urine, dip it and send it for urine microscopy and culture. I would also arrange for a plain KUB X-ray.